Now, what we do know is that there's knee replacements that can last 15 and 20 plus years inside the knee. Now, occasionally and we like to see our patients after they have a knee replacement at least once a year for those years, because we like to keep an eye on that piece of plastic. Because if we can go in there and just change out the piece of plastic without changing the metal parts, it's certainly the right thing to do, and allows that knee replacement to last a lot longer.
Okay, interesting.
Good question.
Great question, Carl. Any follow-up to that, or did that take care of it?
I'd like to say that I have had mine in there since about '96, and it seems like it is getting a little loose, but it's still not really giving me any kind of problems to walk or anything like that. I do feel that mine was a earlier model, let's say, and I don't have the movement I needed. I thought I should have, but other than that, too, I'm satisfied.
Okay.
And just to follow up, Carl, a lot of times with that plastic wear, you may not get pain. And to Jeff's point, it's important, just like you take your car in for a tune-up if it's running well, with joint replacements, they're mechanical parts. So every year or two, you should have them x-rayed, even if they are not giving you symptoms, because the surgeon may see something that they think is important, even though you're not having pain. So I would encourage you to get an x-ray of that knee.
Okay, hope you can do that, Carl.
Thank you.
Regular scheduled maintenance,
That's
right?
That's right.
You need that sticker. All right, thank you for calling, Carl. Take care. Uni-knee replacement, where you just replace a single compartment of an arthritic knee. Are partials pretty common these days, and who's really a candidate, if you can describe a patient?
Sure. So what we're talking about is not having arthritis in the three compartments. So if we divide the knee on the inside compartment, the outside compartment, and then the compartment underneath the kneecap. Most commonly, if someone is maybe a little bit bow-legged, they tend to wear out the inside compartment. That's most commonly what we see. If there's only arthritis in that one part, then typically they're a good candidate for a partial knee replacement. Now, the benefits of that, obviously, is you're keeping the other parts around, which are good parts. They're still intact, the cartilage is good, and plus you're allowed to keep your ligaments. If you can keep your ligaments, then you're going to have a more natural motion. And that's the whole idea. And then the surgery itself is actually, it's obviously less. You're not putting in as much, you're not cutting as much bone, so it's less pain, probably less blood loss, and the recovery seems to happen a little bit quicker. Now, the most important decision about that is whether or not you're a candidate. Now, unfortunately, not everybody's a candidate for the partial knee replacement. Probably the most important decision is if you have arthritis that requires a total knee replacement, then that's what you should have, rather than try to have a partial when you really need a total.
Get it all over with. Just
Correct.
knock it out if
depending on what
need to.
If you have the brand of arthritis that goes along with having a partial knee replacement, then it's a great surgery.
Okay. All right. Let's go back to the phones, and Shirley is on line one. Hello, Shirley.
Yes, I'm here.
Go ahead with your question.
Well, my question was, I do have bilateral knee replacement, both of them, and I have the metal. My replacement part is all metal, both of them. So I was wondering, do you replace the metal with the plastic, remove the metal from your body and put plastic in?
Okay, interesting question.
Yeah, well, Shirley, we know that the parts in the knee, so you have metal attached to the end of your thigh bone or femur and metal attached to the top of your shin bone or tibia. And
I hit part of it. I'm sorry. I didn't hear.
I was just saying, you do have metal attached to the ends of your bone,
Yes.
but all of the knee replacements that I'm aware of have a piece of what we call polyethylene. We refer to it as a plastic. It's a hard plastic that goes in between the two pieces of metal. So you may not be aware of it, but you do have a piece of plastic in between, and that's the part that can wear. Occasionally, or many times when the plastic wears out, as the body reacts to the plastic, it can also cause some loss of bone around the metal parts, and the metal part can loosen from the bone. So oftentimes when we redo knee replacement because they're worn out, we do have to refix metal parts to the end of the bone. Now, in hip replacement, we don't always use a piece of plastic, but in knee replacement, there is always a piece of polyethylene or plastic.
Okay, Shirley, anything else while you're on the line?
Well, tell me, if you're not, I'm not having any problems with them. I just want a better range of motion.
She wants better range of motion.
Well,
Yeah, and the research that I got said that the complete plastic knee replacement, you do have the same range of motion almost that you did with your own bones. And I'm not all that steady. I haven't had any problems with them since I got them, actually. But anything almost can throw me down. So I was just wondering if it was possible to remove the metal and just have total plastic knee. But I think I understand what he's saying.
Okay.
Okay.
There are a lot of things that go into knee function. Knee replacements get rid of pain. You're not always going to get a full range of motion in the knee, and strength doesn't go with the knee replacement with rehab, but typically a year or so after surgery, the motion that you have is probably the best that it can be without another surgery.
Okay. Shirley, thanks for calling and good luck to you.
Thank you.
Thank you. Bye-bye. We have Ryan on line 2 next. Hi, Ryan.
Hello.
Yes, go ahead with your question or comment.
I am 34 years old and I had a strep infection in my right knee and it ate the cartilage out between the bones. And I was just wondering what my options were. They told me they could not operate because of the infection coming back. I just wonder what my options were.
Okay.
That's the number one thing, obviously, to worry about is the history of infection inside the knee. Now, certainly, if the infection has worn away or eaten away all of that cartilage, and you're left with a knee that essentially has no cartilage and is bone rubbing against bone, that's not ideal. The treatment then would be centered around, number one, getting rid of that infection. So there are things that we can do, and a lot of that has to do with removing the infected bone or infected soft tissues and the cartilage inside your knee first to try to eradicate or get rid of the infection. And then the second part of that, after we know that the infection's gone, then would probably be a knee replacement if indeed all that cartilage has been taken away by the infection. So again, while I don't think it presents a difficult problem, I don't think you're left without any options at all. I think it's certainly something that you could be helped with.
Okay, Ryan?
Thank you.
All right, thank you for calling. Good luck to you. With a younger age person calling in, it reminds me of juvenile arthritis for the really young kids. About 300,000 children are affected under the age of 18. Are they likely to end up with joint replacements if you're someone with juvenile arthritis? Are you looking at that down the road?
Well, they're definitely higher risk.
Yeah.
Fortunately, the medical treatments for that disease have improved as well, quite a bit. And the early diagnosis and medical intervention has probably kept many of those kids from needing joint replacement early in their life. And so that's definitely the most important thing, is having a fairly early diagnosis, getting involved with a specialist, and getting medical treatment. Because again, if you can treat the inflammatory cause in the joint, you may prevent the cartilage from wearing out in the future.
What's the youngest patient you have done a knee replacement on?
I think 28, and it was somebody that had a trauma.
Trauma injury, okay. All right. Would you advise someone after they've had a knee replacement to avoid any particular exercise like jogging? Or can those people, if they were a runner before, can they go back to running and doing some of the higher intensity exercise? You're both smiling.
What we know is, again, it's metal and plastic. It's not designed for this. It's not designed for impact. So anything that presents impact type activity is not ideal for that environment. Now, what it is good for is gliding type activity. So things that are lower impact, obviously walking, some of the cardio machines maybe at the gym. Swimming is a fantastic thing to do. Biking is great. We have patients that go back to tennis. The official recommendations really say kind of maybe stick to doubles tennis, because again, singles tennis has a lot of side-to-side type movement, and the knee replacements aren't quite there to allow for all those type of maneuvering around the court.
I I know we haven't talked too much yet. I probably need to move on from the knees to hips. Let's talk about hip resurfacing, because I know that's something some people are candidates